You know, I know that you have a lot of stuff on your mind. You got your girlfriend, your bills, the boss, you got a lot of stuff going on. Yeah. I want to kind of show you something that's been helpful to a lot of other people who are going through the same thing, who just have a lot of stuff on their mind. So I want to show this to you. So let's kind of do it together. Let's just sit back and do it right now together. I think that's the best thing. It's best to teach the container, calm place, deep breathing, and mindfulness interventions experientially. By doing it together, the patient feels more comfortable, and you will know the right questions to ask. Since many people feel vulnerable when their eyes are closed, let them know they can also look downward. So why don't we just sit and kind of take a couple nice breaths. You can close your eyes, or if you're not comfortable with that, you can kind of look downward. And what I want you to do is to imagine a container. So what just popped into your mind?
Seeing one of those rectangular blue tubs seeing in middle school.
Okay. So you're seeing kind of a rectangular kind of tub. Yeah. What's it made of?
Plastic.
It's plastic,
Shiny.
Okay. And it's blue, you said? Blue
Yes.
plastic? Okay. Okay, so I want you to imagine taking the lid, a lid off that. So it's like a box. Take the lid off of it. And I want you to imagine putting all the stuff that you have, that you're worried about, that you're getting upset about, all the stuff that's on your mind. I want you to imagine one by one, everything is going into that box. Okay, so we know it's there. We're not in denial. We're just taking a little break from it. So what should we put in the box?
It's just anger I have for my girl and this misunderstanding. I love her to death, but it's just, she doesn't understand. I get so angry.
Okay, so you want to put your
I'll
anger.
Put that in the box.
Okay, your anger at your girlfriend, or just the situation, everything, all that stuff with your girlfriend, putting that in the box. Okay, and what's going to happen down the road? Imagine that going in there. What else should we put in there?
Just the stress from my boss.
Okay.
Stress from my boss. I just wanted to put and just throw it in there.
Okay, so the stress with your boss, let's put that in there. What else do you need a break from? All those emotions you have, feeling upset, all the worry.
Car bills coming up.
Okay.
All these things, payments.
Okay, so just your
so
bills.
It can just go in. All of it can go in there.
Okay, so just imagine them going in there. All your bills are going in there, your financial worries. Okay. Don't worry about what the patient is putting in the container. We're trying to help them feel more in control by deciding what and when to think. They can go back to the box or not. It's their choice. Patients who struggle with visualization can always do this with a real container by writing everything down and putting it away. So why don't we put the lid? Can you imagine the lid now?
Yes.
Okay, so put the lid on the box, and let's figure out, where do you want to keep the box in a safe place where you could access it if you wanted, but it's basically away. You're having a break from it.
I want it on top of my shelf in the corner of my closet.
Okay.
I want it up there.
Okay. So imagine opening the door to your closet and you're putting the box in there, and then you're closing the closet door. And what you can do is you can always take it out if you want. Okay?
Okay.
So go ahead and open your eyes. How do you feel? You feel better?
I feel lighter.
Okay. So here's what I want you to do, Jamal. Whenever you are having a lot of stuff and you're worried and you have a lot of stuff on your mind, I want you to close your eyes, imagine the container, and kind of put it all in there and put it away, and just tell yourself that you're going to be okay. And then when you need to deal with it, you can take it out one by one, okay?